Hi, everyone. Good morning. Thanks for tuning in into our webinar today on population health management. And the topic we have laid out for today's conversation is that how do we establish or help establish an return on investment based approach for population health management initiatives? As we all know, population health management has been a key focus area in our industry, but bringing a change in terms of last mile where clinicians are able to leverage their insights and engage with members to help influence the behavior and change the outcome, more from return on engagement, return on investment perspective. It's always been an eluding factor. So we have a distinguished panel here today. It's going to talk about what practical strategies which we can bring into play from an industry point of view and help achieve that missing and eluding last mile impact. But before we get started, a quick round of introductions. Uh, I'm Shurish Tiwari, a principal at ZS Associates, focused on working with health plans. In terms of my background, I spent over 25 years in this industry and have served both payers and providers in my entire adult life. So with that, I'll request Dr. Charles DeCesar to introduce himself.
Sure. Charles DeShazer. I'm the Chief Medical Officer at Highmark Inc. I'm a internist by training, and most of my administrative career has been focused on informatics and quality the past 30 years.
Thank you, Charles. Eric, you want to go next?
Good morning, and thanks for having us, Sharish. This is Eric Grossman. I'm the CEO of NextHealth Technologies, an analytics platform for over 60 million Americans. And prior to NextHealth, I was at TriZetto, a core admin company, and have over 20 plus years, similar to the doctor, of experience in healthcare IT systems. So pleasure to be here. Talk about the last mile.
Thank you, Charles and Eric, for taking the time. As we get into the conversation, I'll just spend some time talking about, what are we planning to achieve today. So taking the conversation in two parts. One, historically and traditionally, from population health management point of view, where those challenges have been in terms of establishing an ROI, return on investment. And second, a part of the conversation is that in our current operating environment, as we all are in this pandemic situation, and it has been there for past 7-8 months, it's going to go on for a little while. So what has changed? And keeping that operating environment in mind, what needs to be done in order to continue to move the mission forward and adapt to this new normal? So that's the two-part conversation today. In terms of little bit of context and background for everyone's benefit, historically, population health management has been very focused on triple aim of healthcare. And the first and foremost has been reducing the cost of care. Second, engage with members and patients and improve the quality of care. And in order to do that, identify the risk, the population at risk. But it's been a challenge, and it's been primarily because of the way our industry has stayed organized, that most of the care is based on episodic care, based on encounter-based medicinal care. And that's where if we see some of the data here, in United States, we spend 60% of our investment on providing medical care, and the impact is only 11%. Likewise, if we look at the other determinants of health which has been emerging, like individual behavior, so that has a significant impact, but has a relatively lower spend. Likewise, if we look at environment, it has an impact, but the environmental considerations are now being taken into account. And social determinants of health as well, which has been more of a buzzword, but now we are at a point where it needs to be brought in play because the investment is rising and the impact is also rising. So considering the changes we have had with regards to the determinants, if we look at it from our population health management point of view, some of the things needs to be taken into account. That are we targeting the right population? Is it the right way to look at the highest risk population and create intervention strategies for them? Or we just stay focused on engagement, or we need to take the conversation beyond engagement and start thinking about an outcome generation, which should be based on some sort of an evidence. So how do we go after creating an evidence-based strategies? And that's where ZS has been doing some work. We have a framework in place. Have been helping many health plans, which is not only focused on creating identifying the population, helping create strategies to engage with members and patients, but focus on the last mile, which is more in terms of outcome generation, so that health plans can take their members from illness to wellness and have a very direct, tangible impact on the health of their members. Now, what it does, the process, it helps, the way it helps is instead of just focusing on the highest risk population, create the micro and macro population segment. Also identify the population which is rising at risk and can create the maximum engagement and maximum outcome. Help create strategies and insights to drive an evidence-based strategies and develop a way to integrate those insights into clinicians' workflow, which has been a challenge because most of the interaction has been based on the encounter-based medicinal approach we have taken. And in the process, it helps in driving the value-based care engagement as well, which creates a right incentive for the entire ecosystem. So it's a win-win proposition. This is an approach we recommend in terms of driving value and creating an ROI-based approach. At this point in time, Charles and Eric, I would like to invite you both and will like to learn from your experience that in the wake of our ongoing pandemic and this COVID-19 situation, what changes you have seen happening? And perhaps, we will start with you, Dr. Charles, as you have been a physician and you have been experiencing and having a firsthand exposure there.
Sure. Thank you, Sharice. I think the key element that has occurred as a result of the pandemic is that it's really accelerated the digital transformation. And in my current role, and in my past experiences, I've worked on the provider side and the plan side. And what we found here in this current environment is that the barriers to telehealth and telemedicine have really been mainly regulatory barriers. As of today, technology is not the barrier necessarily. We have issues of broadband access, et cetera, but that's not an insurmountable barrier from that standpoint. And the other aspect is that we found that the patient and member acceptance is not a barrier, which is what we had anticipated in the past. So what the pandemic has done is really accelerated the digital infrastructure establishment. It has really accelerated patient and member acceptance, which is really advanced significantly. And it's improved our ability to create a continuous connection to the patient or member. And to your point, it gets us out of this episodic care model and into a continuous care model. And I think it's important to recognize that, again, to your point that you alluded to, is is that this is going to give us a greater ability to detect rising risk in real time, where we really have an opportunity to intervene more effectively. You know, as they say, an ounce of prevention is worth a pound of cure. And this is why this particular evolution in the industry is going to have a tremendous impact on population health management and our ability to generate ROI.
Great. Thank you. Thank you. Thank you, Charles. Eric, would you like to share your perspective as a practitioner in population health management space, and what have you been observing in terms of the COVID-19 impact?
Great. So I think I would double click on an ounce of prevention is worth 2 pounds of cure. You know, never in my career have I seen such a spike in healthcare utilization. I think at most of our customers, it's the majority of claims, and it's sea change. You know, when there's a 50x adoption of telehealth, and even on this phone call, we're all virtual. You know, the things that you can see behind people and in their medicine cabinets, I'm quite confident are dramatically going to change the way healthcare is delivered. Probably similar to the way e-commerce was and is, and the impact that's had on consumer behavior. And I'd say the second sort of dimension that we've found is due to the pandemic is a huge increase in focus on mood disorder, behavioral health, and also deferred care utilization. I think this is the first time in the U.S. where we've had cholesterol scans and other types of preventative diagnostic testing gone down. So there's a big focus in deferred care utilization as well.
Awesome. Thank you. Thank you both, Charles and Eric. And certainly, you know, as we all have seen, the digital and virtual care have had a rapid acceleration. It took time, but some of the operating environment challenges forced upon us, and even the provider adoption have been great on that. So certainly, it's something that has moved forward, and even in future, there is no going back. More specifically, from population health management point of view, how do you see that has impacted, that adoption has impacted the population health management initiatives?
So from my perspective, you know, I would underscore again the move to more continuous connected care. Now, so what's the impact from a plan perspective? I think for us, from a plan perspective, and in general, it gives us an opportunity to further enhance the digital ecosystem and connectivity between all of our interventions and you know, particularly population health management interventions. So, for example, the entire industry ecosystem is moving to digital transformation. For NCQA, they're moving to e-quality measures, for example. We're moving to more of a dependence on FHIR as a way to connect the dots and actually create automated guidelines, for example. And so you can imagine connecting this digital ecosystem with, you know, data analytic insights that can power guidelines and quality metrics, and all this becomes more automated. So from a health plan standpoint, this is really important for us because we tend to be in a position to orchestrate this, you know, care system and ecosystem, and if it's facilitated, if it's a digital infrastructure and architecture to orchestrate. So it's really going to facilitate tremendously planned and as well as provider capabilities in terms of impacting quality.
Fantastic. Thank you, Charles. Eric, you have a perspective here?
Yeah, I would say for our customers, they're still sort of crawl, walk, run, because it was really a faint pulse on digital virtual care adoption pre-pandemic. And there's more research at this point, but great plans, because there's early but strong evidence that telemedicine actually has a positive effect. Most of the research pre-pandemic basically thought that, it was sort of like pushing on a balloon. On one side, it perhaps added more cost. But based on our scientific outcomes research that was done longitudinally, we believe that it actually is saving money and will fundamentally change healthcare delivery. So at this point, our customers are focusing on what's working, what therapeutic treatments and telemedicine, which providers for which members, and they're doubling down on the role of analytics that it can play in both understanding what's working and not, but importantly, how to improve the physician and member experience with things like FHIR and API and other types of augmented intelligence. So I think we're at the beginning of the journey and have a long way to go, and perhaps we'll never see the end.
Yeah, I'm in complete agreement with both of you. The data inoperability movement is certainly going to provide the ability for us to create a seamless ecosystem, abundance of data, all from member, plan, and provider perspective. We are certainly moving in the right direction, and I'm happy to see the amount of change which has occurred in our industry in past couple of years, comparing it to past 20 years or so. But it also brings in an interesting perspective here that with this abundance of data and digital touch points, what kind of analytics and insights you think will be valuable from population health management point of view? And also considering the fact that our care of site is shifting. The care of site is shifting from hospital to outpatient to home. So, and eventually we will get to more of a federated model where there is a virtual care, there is a physical care, and in this federated model. So keeping that continuum in mind, what specific analytics and insights you think would be valuable for population health management initiatives? Charles, will start with you as a physician perspective, and Eric will follow up with you.
Well, I think we've had the fortuitous convergence of several technological advances in the past 3 to 5 years, and to your point, these capabilities are just coming online. So, for example, big data management, the ability to effectively, efficiently manage huge volumes of data, that's relatively new. Obviously, the advancements in terms of AI and machine learning is revolutionary. I mean, we're in the very early stages of really understanding the value and impact of that. And what that's leading to are, I think, two critical capabilities that are becoming more effective. One is to generate very rich insights now because of the breadth of data that we have. A lot of times we would generate insights from minimal data points. Now we can have hundreds or thousands of data points that can generate richer insights. And obviously that's leading to more effective predictive models as well. Many predictive models in the past were not as effective because they were missing key data elements that were not really causal in relationship to the prediction. So we're becoming more effective in that space as well. So I see over the next 3 to 5 years just a tremendous advancement. And to your point, this is a federated model, meaning that it's going to be an orchestration element and connecting the dots. And so from a provider standpoint, what I would be looking for example, from my plan or whoever, whatever resource we have supporting this effort in population health management, is the ability to generate actionable insights for me, for my population, that I can leverage in real time, And again, moving away from the episodic treatment, many providers are moving to team-based care, patient-centered medical home models where you have time to do population health management. And what will be valuable in that space, are really actionable insights and predictive models to help me be more effective.
Great. Thank you, Charles. Eric, from your perspective, there is a physician point of view that we look forward to actionable insights, and the real challenge lies the way the data is organized, and these analytics need to be created and create an insight which is actionable. What have you been observing in our current environment, and especially with this abundance of data available to us?
Sure. Well, it's not easy. Think of it as sort of a pyramid of insights, and ultimately you want to get to the bottom of the pyramid, which is the member and specific provider. But with a 50% increase or 1,000, depending on the health plan, you do have a lot more data, but data is a long way away from a behavior change, and a behavior change is a long way away from return on invested capital. So our customers are looking to systems and tools and capabilities know each day and every month who are these virtual channels working for what conditions, for what providers, for what network, for what plan design. So far, let's geek out a little bit with some real data on what we found. Just given the N has increased quite exponentially, we're able to do some pretty sophisticated pre and during C19 analysis using things like matched retrospective cohort analysis across our customer base. And we did determine, wait for it, drum roll, material claim savings predominantly resulting from expensive ER visit reduction. And it's quite significant, ranging from 29 to 62 visits per 1,000 members per year reduction. And also visits to the PCP have gone down anywhere ranging from 65 to several hundred visits per 1,000 members per year. And in a health plan, those are big numbers, and they're going to get some attention to study the journey map and the conditions that it is working, so they're not sort of blanketly covering their population. And the areas that we're seeing, the therapeutic areas that we're seeing impact is behavioral health, as I mentioned earlier, but importantly, post-discharge from the hospital planning to prevent readmission, that many of the services that are discussed in person can be discussed virtually. And then last, the ER super utilizers seem to be picking up quite significantly the use of telehealth. And some of the questions that we're still getting to is for these people that have been using it 1,000x in the market, telehealth, it's definitely gone down, but nowhere near the levels that it was pre-pandemic. So how do we reach these folks and continue to drive persistence in these positively impacted populations? And importantly, the doctor mentioned FHIR and other interoperability standards. How do we provide the physician member clinical support at the point of service in those interactions so that it's more like the experience they had pre-pandemic?
I completely agree with both of you. And as I reflect back, there is a physician point of view, which is more in terms of driving actionable insights. And there is a data and analytics, more of an actionable insight generation perspective. And both are in tandem moving forward. Now, bringing another perspective, just thinking about it from member point of view, historically, we have looked at proxies of care, and more so in a chronic condition space. So if there is a diabetic patient and we are doing a foot exam, using this data and analytics and machine learning algorithm, we can get to an understanding and find out that instead of using that as more of an episodic proxy for care, use that encounter and analytics around it to find out the propensity of having a wound which won't heal for the given patient. Now, certainly from industry point of view, there is a lot of work to be done to get there, but this adoption from digital and virtual care and from technology point of view, this has provided us an opportunity to get to that individualized level of care, which could be provided by the insights driven through AI and machine learning algorithm, and the data available through data inoperability. Shifting a little bit gear in here and looking at from the overall US population point of view, Charles and Eric, I agree with you that virtual care adoption is there, acceleration is there, it's moving forward. But data also suggests that there are around 21 million folks in United States who are still not connected, and they are in rural and remote areas. How do you see them managing this kind of a digital divide, and we help create individualized intervention strategies and care for them?
Yeah, I think that addressing the digital divide is going to be absolutely critical. And I think that obviously is going to take some policy action and investment. It's going to take a multi-stakeholder approach. Ultimately, I think the ROI is going to be tremendous from that investment, because getting care to those rural areas will address their primary issue is, geographic barriers. Telehealth, telemedicine, remote patient monitoring all begin to address that issue. And you can also address the issue of access to specialty care, for example, through telehealth, telemedicine for the rural areas. And so I think really establishing that infrastructure, leveraging new technologies, 5G, et cetera, is going to be critically important for that particular population.
Great. Thank you, Charles. Eric, do you think there is an ROI, return on investment, for health plans to pay for this connectivity? Is there a cutoff from their perspective based on your experience?
Absolutely. And it really, the answer lies with sophisticated and available analytics that can determine with precision which and by how much risk you want to reduce in these populations. So as opposed to just saying we have to go after rural populations, we can determine with precision using an A/B test or a randomized control trial that the health plan can optimize risk reduction. And in this case, connectivity at the member level, zip code, county, block, you name it. And I'll also say, in addition to the analytics, that there are many state and federal grants that are offered now for this very purpose. And obviously that improves the return on investment.
Great, I agree. And also, if you look at the way we have had adoption for smartphones, perhaps it provides an opportunity for a mobile-first strategy, that internet connectivity could still be a distant objective, but in the immediate term, this digital divide can be taken over by adopting more of a mobile-first strategy here. So this has been great, both Charles and Eric. I learned a lot from today's conversation, and as we discussed through the topics today, certainly in our current ongoing operating environment, the digital and virtual care has accelerated. It has provided an opportunity for us to leverage data and analytics and create insights which could be leveraged to drive more of an evidence-based strategy, could become part of clinicians' workflow, and then physicians could engage with members and change their behavior or help influence the behavior so the outcome could be changed. The second thing I learned today is looking at the population itself. Now, more often than not, we focus on high-risk population, but at times it's difficult to change the outcome and influence the behavior for chronically ill segment. But what about the rising risk population segment? That's where the data and analytics and insights could be leveraged to influence the behavior and change the outcome. And machine learning algorithms, AI, could be very useful. So these are my key takeaways from today's conversation. Before we wrap up, any closing remarks from you, Charles?
No, I would just say this is a very exciting time. And again, I've been in this, informatics arena for, 30 years in quality. We have never had the opportunity and capability that we have today. And I just think we're going to see advances in the next 3 to 5 years that we've imagined for 20, 30 years, but we can actually achieve them now with the current infrastructure and capabilities.
Fantastic. Thank you. Eric?
Yeah, I would just double click on the exciting nature of and the positives that are coming out of the pandemic. In the wake of this, I think the biggest question our customers are asking is telemedicine working? Is it saving money? And according to our customer group and our data, the answer is yes. And our customer base believes it's here to stay in some form. That all said, the magnitude and the sustained savings will entirely depend on a variety of factors, including the ones that the doctor mentioned: provider, member experience, connectivity, network design. I think is the biggest unknown around network design. You think of a lot of these single shingle shops, these provider shops, for some of these specialty areas, what if the Cleveland Clinic comes into these rural, remote areas in a virtual network integration is a big unknown. Behavioral health support, and how are we going to get that into these telepsych programs? What partnerships will emerge? We saw Teladoc and Livongo. And I think ultimately the key telemedicine factors, in our opinion, selfishly so, will ultimately be revealed and optimized with a strong and scalable analytics capability.
Great. Thank you. Thank you both. It's been a very productive and interesting conversation. Let's look into any questions we have received from the audience. Here is one. So the question is, I'll read it out. Can you speak to the organizational change management side of COVID-19 and analytics impact on PHM? Let's start with Charles, and Eric, you would like to follow up?
Yeah, I would just underscore that one of the biggest, most significant challenges will be the change management aspects across the board. For example, there's been a greater acceptance by consumers of telemedicine, but there are some physicians that are still challenged with it, even though they've jumped in and they've had to become more comfortable with it. Some still don't feel like it's equal to in-person care, and there are things they can't do in a remote fashion. So we're still going to have to manage that and understand that, and understand what are the real differences, and move teams along on the provider side as it relates to that. So I think the change management aspects are really going to be huge, but I think that analytically, we just really have a huge opportunity to be able to integrate these more effective insights into the workflow of clinicians and plans in terms of their interventions as well. So I think the change will be worth it, from that perspective.
Thank you, Charles. Eric, do you have a perspective?
Yeah, again, great comments. I would just echo Charles, that the biggest challenge is not necessarily generating the insights, but acting upon them, both at the member, the provider, and the health plan side. So I do believe we need to wrap this discussion and any initiative that's going on in the people side. For example, A lot of our customers have these medical planning action committees that meet regularly to review the data. The training side of the insights, how you design studies. Do you use a randomized control trial? Do you use an A/B test? Do you start using Z codes that are ICD-10 codes? How do you interpret the results? And while in our case, we're an analytic platform, we need partners to help with the people side of the equation. And we actually partnered with ZS and Shreesh to support more of the organizational change and system integration, workflow integration side of the equation.
Great. Thank you, Eric. And yes, this has been a valuable partnership for us in terms of developing this end-to-end population health management framework for us, which again, not only focuses on identification and engagement, but closing that loop in terms of outcome generation and creating that that insight so that the physicians could engage with their patients in a more meaningful way. And again, that's no matter how federated we get, but that trust which members have with their physicians is invaluable. And we need to find ways to enhance and leverage that trust in order to change the outcome. And that's the best way to provide that member experience. Looking at chat and the second question here, I think it's a great question. So what specific insights you would recommend to drive evidence-based strategies? So we talked about analytics and insights here, and I'm sure this is a question coming from a physician and a practitioner. Mm-hmm. So Charles, would you like to take a stab on it?
Yeah, I think the important point, and I think Eric made this point earlier, is that as it relates to population health management and having an impact on outcomes and thereby driving ROIs, nothing happens until you get the behavioral change at the member level. And I think to your point, Suresh, the trust relationship is persuasive and influential in driving that change. And so I think that just in general, the more solid, I think from a physician standpoint, the evidence is in making that recommendation gives them more confidence and more of an ability to communicate that to the member that I think will be more influential. I mean, studies have shown just even a physician telling their patient to stop smoking is the most impactful intervention for folks to actually stop smoking. And so you can imagine if you can really craft much more sophisticated insights and conversations that the physicians can have with their patients to drive more complex behavioral change, the kind of impact that can have over time.
Thank you. Eric?
Yeah, if I put my consumer hat on, regardless if it's a physician visit or Amazon, I have to seek value and convenience. And, for all the folks who, thought that Amazon was only going to be a bookstore, they got it wrong. We've seen the largest shift in value in the history of America, or probably the world, to Facebook and Amazon and Google. So ultimately, coming back to the visit with Charles and as a physician, I need to see me first. I need to see my information. You need to know who my PCP is and what my conditions are and where I should go and what kind of drugs that I have and what are the interaction and what's in my cabinet. And it has to be convenient. It has to be on demand. When we need it, we need to be able to see the physician and they need to know about us. So I think we've got a lot of wood to cut to deliver that same experience. But with the growth and utilization that we talked about and the return on investment, I'm quite confident that the Highmarks of the world are making the right investments. And the fact that we have the chief medical officer on the phone, it's not easy to do to get his and her time. So we're pleased to be having this discussion and be at the table as we see this sea change event in telehealth adoption. And I can speak to my own father. He's a surgeon. He never thought telehealth would be valuable and still doesn't believe in it to this day. So I think we've got a lot of behaviors to change, not just the members, but also the physicians. But there's no looking back, right, Doc?
Absolutely. I totally agree. 100%.
It's been incredible. Thank you so much, Charles and Eric, for making the time. And for audiences, for population health management, our current ongoing pandemic has provided a great platform, both from digital care, virtual care perspective, adoption of data and analytics to create these meaningful insights, make them part of clinicians' workflow, and then put them in clinicians' hands to help change the members' behavior and change the outcome. Just don't focus on a certain population segment, which is at high risk or chronic conditions. There is value in looking across the micro segment of population, the rising risk, the digitally divided from mobile first point of view. And if we bring all of these insights and analytics together, we can certainly move the needle and create return on investment for these engagements and close the gap from last mile change perspective. So thank you again. Thanks for joining in. Have a good day.
Thank you.
Thank you.